Now, I know people die at Lanterman. We are going to die, every single one of us someday. And some of us, most of us, sooner than we really want. But of those 5, I am totally confident 3 would still be alive if they were at Lanterman. I think 4, maybe all 5. How much money have you saved? Well, one of these girls, she was about 28 years old, brittle diabetic, went to a fine placement, but she got into the pantry and ate a lot of jelly. Now, I'm not saying something like this can't happen at Lanterman, but it happens out there a lot more. The Strauss report showed in the 80s that there's an 80% greater chance of death for our clients when they go to the community. So how much have we saved to my client who died? Well, if we use the department's figure, even less, $200,000 a year, we've saved $2 million. And she would have lived another 25 years at Lanterman. So that's a lot more savings. I don't think you want to save money that way. When it comes to their living out there, there's some studies that show for the taxpayer, the overall cost is not nearly as reduced as you think it might be. And most of that reduction comes because of these poor people that are working out here for $7, $8 an hour and waiting for their paychecks. Untrained people, can they give the kind of care that our highly trained psych techs do? And incidentally, that's another reason Lanterman is needed. We are a primary training ground for people from Mount SAC, from other programs that are training psych techs that are needed in the state. I'm told by the professors at Mount SAC they cannot possibly replace us as a training resource. Azusa Pacific, Western, they send their people to us for training. It's another very valid thing to be considered about Lanterman. So I'm here to oppose the closure of Lanterman forever. And someday the expansion, the sooner the better, the expansion of its services to meet community deficits.
Okay.
And especially that you don't take any action on this until we have a far better developed plan and we can show and demonstrate that the services will be in the community.
Thank you very much. That completes the testimony. We do have proposals for budget bill language and trailer bill language. Those attachments are in the agenda. We're going to be holding those open for the May revision. This was a very important and informative hearing. All perspectives are important, and I very much appreciate everyone's participation. We are going to a very brief update on Agnews Developmental Center closure. With some, we do have some questions we have asked, but given the lateness of the hour, I'm hoping we can take this fairly quickly.
I'll try to be very quick. I know there are questions that you have specifically related to the property there. Agnews Developmental Center, when we started the closure process in 2004, there were over 400 residents. The closure process, the last resident did move from the facility in March of 2009. Of the people that moved from the facility, all but 20 moved into the community, including 5 who did move back home with their family members. 20 did move to another developmental center. In terms of the people that moved, the range of disability was similar to the range of disability of the individuals that are at Lanterman today. In the case of Agnews closure, we did, as we mentioned before, have bond money for housing, but some of the things that made it so successful were actually the new models in the community. We've been talking about the 962 model, which are homes for people with special medical needs, were extremely successful. We also had family teaching homes, which was a new model that allowed for consumers to live on one side of the residence, a family on the other side in a duplex, extremely successful. We had specialized homes for people that had particular behavioral needs. In addition, one of the big things that we did right, I think, is that we put into place a very comprehensive health planning process that involved an individual health plan for every single resident at Agnews that included working with the managed care plans in the community and identifying the doctor and all of the services the individual needed before the person left the developmental center. And the staff even came in many cases if they were moving to a home in the community and were trained while the person was still in the developmental center. Another thing that was very, very successful. Something mentioned today that's imperative is the quality oversight and the quality management system. I think that we've done that well in the case of Agnews. Clearly, we would need to model it appropriately for Lanterman. But what's imperative, as a couple of people mentioned, is the oversight committees and having everybody involved. We have had everybody involved and intend to continue to do so, and we'll be establishing advisory groups that will involve residents, family members, the community, the advocates, so that we make certain that we do it right. We want people watching what we're doing, and if there's a problem, we want to fix it. So I can respond to questions, but I wanted to do very high level because I know it's late in the agenda.
Specific questions that we asked DGS to respond to. And again, the hour's late, so we'll ask for a brief answering of those questions.
Sure. Melanie Perrin from the Department of General Services. Good evening, Chair and members. We know you've asked us specific questions regarding the property disposition process, what we're going through right now. Currently, the DGS, when we get surplus authorization to dispose of a property, we go through a process of first having to request of other state entities if they're interested in the property. In this case, no state entities wanted the property, so then the process goes to local government entities. We do have the Santa Clara Unified School District who is interested in a portion of the Ag News property, so we are currently working with them. After we work through that with them, the balance of the property, first right of purchase can go to Cisco Systems based on a previous agreement. So we're also working with Cisco on that. Our estimate for the property value at this time is $60 million. We will be doing an appraisal.
You said 60?
$60 million.
Okay.
We will be doing an appraisal.
Make sure I heard correctly.
60. We will be doing an appraisal as we come closer to closing the deals on those properties with the school district and with Cisco. The timeline that we're anticipating to disposing of the property is within fiscal year 10-11. It's dependent on a few factors, but at this point we have no other reason to believe we won't be disposing of the property within the next fiscal year.
So the selling part of it to the school district is not in conflict with the Cisco agreement?
No. Cisco gets the first right of purchase after we have worked with local government entities.
Okay. Thank you.
Lastly, we know there's been concerns with the cogeneration plant there. We are looking at options right now, what we can do about the facility. Unfortunately, because we are in negotiations on the property and this is a negotiation tool with the property, we can't really go into much detail, but we would be happy to provide the committee with more detail in the future as we come closer to and getting the deal done.
Okay. And I think that answers the questions, and so we'll thank you very much and move on to, we're going to skip issues 4 and 5 mercifully and carry them over till next week. But we're going to end on issue 6. And let me find my place here. No, I think I'm caffeinated enough. Thank you. That was very kind of you to provide the previous one. Okay. Issue 6, $25 million savings target plan. Let me ask DDS to please respond to the questions we submitted.
Yes, Mr. Chairman and members, the governor's budget, when it was released in January, did include a direction to the department to work with our budget advisory group to identify, for the department to identify an additional $25 million in general fund savings. The discussion did occur with the budget advisory group at a couple of meetings, and we did seek input from them in terms of ideas. The department evaluated the ideas and did put forward a recommendation just recently that the additional funding be achieved through an additional 1.25% reduction in payment to the regional centers and to the providers. Currently, and this committee has adopted a 3% payment reduction. This would increase it to 4.25. In addition, however, we are recommending, and we will have trailer bill language shortly, that will give the ability for providers to get some relief during this time. We recognize that this has been an extremely difficult time. The reason that we chose to recommend the 1.25 was to spread it as thinly as possible across our system and not impact any one area. We've got 66,000 providers, and so by doing it this way, we hope that it has the least impact. I don't want to suggest to you that it doesn't. As we talked about with the 3% reduction, the system has been struggling under reductions for many years, and this is very difficult for them. In terms of the Relief that back in the 1990s, when there were budget reductions to our system, there was language provided that authorized for flexibility in certain regulations, as long as they didn't impact the health and safety of consumers. We are looking to mirror what the legislature adopted back in the 1990s. In addition, there's a couple of reporting requirements. While nice in times when people have resources, in times when we're so tight, they're probably spending them on, they'd be better spent on direct services. So we're looking at suspending a couple of the reporting requirements that also do not impact the health and safety of consumers. So we will be putting forward trailer bill language with the specificity, but that is the recommendation.
Okay. LAO, do you have a response?
Mr. Chair, we're waiting to see the trailer bill language, but we think that increasing the reduction in the payment, provider payments, is an efficient way to achieve the savings. You can count on getting those savings.
Okay. Finance, have anything else to add?
Hawaiian Department of Finance, we have no comment.
Okay. Okay, I think we're...
I have a question.
Oh, yes, I'm sorry, Mr. Emerson.
You mentioned about minimal impact on the consumers. Can you give me some more information on that, what that impact would be?
Minimal impact as it relates to the additional reduction or as it relates to the relief? To the reduction?
The reduction.
Again, as I mentioned before, we've got 66,000 providers in 21 regional centers, and obviously it would be different depending on how much they bill, because it would be 1.25% reduction in payment. But if you spread it out over all of them, you're looking at about a $700 impact throughout the entire system. And we think by spreading it, the impact will be far less than if we, for example, chose one certain area and didn't provide the services in that area. Again, I'm not suggesting that our system has been struggling for many years, and this is going to be difficult, but we thought this would have the least adverse impact by spreading it as thinly as we could.
Okay, thank you.
Okay, so we have a bunch of people who've gotten up to talk, and I suspect that I can say something that might shorten their testimony.
They don't like it.
Well, we don't have the votes to do this, but as chair, I'm going to ask you to go back to the work group and discuss this with them and what the options are. We
did discuss this with them, Mr. Chair.
Okay, well, I want to make sure there's a more complete discussion. I'm guessing that they're going to say that they're dissatisfied with the discussion to date. So we are going to be I will be asking you to discuss it with them further. So that being said, public testimony. 2 minutes.
Mr. Emerson.
I've been admonished to get it down to 2 minutes now. So now that's 20 minutes to 8.
I'm not surprised to see the same two members who've been here all these hours still here. We of course oppose any further cuts. We've discussed that. We'll be back after the revised discussing that much further. I'm sure one of the worst cuts that occurred last year was in the early intervention program that helps kids avoid a life of developmental disabilities, intellectual developmental disabilities. It was partly replaced by what's called a prevention program that consists of intake, referral to generic services which are not designed specifically for people with intellectual developmental disabilities and may or may not meet their needs, but is better than nothing, and tracking so that we don't lose track of them. We think those services, even though they're only covering 3,000 people instead of the 17,000 kids that anticipated, are important, and we'd like to see those continue. We understand they're actually spending about $5 million this year, which is considerably less than the $36 million that the governor's budget proposes for the program next year. We'd like to take the rest of that money and put it back into Early Start to actually restore some of the cuts to actually provide some services to kids. We can be optimistic, can't we? Mostly, though, I want to talk to you about some of the problems with the trailer bill last year that we're proposing language to try to fix. The big one that was on your action agenda tonight when you thought you might have a quorum was placeholder language to assure that the regional centers inform parents and clients of the exceptions that are available in current law, that they're not always in the chaos over implementing the cuts last year, they're not always informing people over. We think this would have no cost because they have to give notice to consumers already. So we hope that when you meet next week, you will adopt it both as placeholder language for broader fixes of the trailer bill, and because it's a good program, good language in itself. We've suggested some other trailer bill language to assure that the Lanterman Act process, of where the consumer is consulted in the process, it remains in the Lanterman Act. There's been some misinterpretation that it's not there anymore, and that there shall be exemptions granted, existing exemptions when someone is eligible for them, if it's necessary to keep someone safely in their home. Finally, with respect to respite care, this was one of the big problems in the trailer bill last year. It came out, the way it came out was inequitable, that the people and it was prioritized, but it was prioritized backwards, that the people with the most need took the biggest cut. People with the least need, although certainly a need, took no cut at all. We'd like to see that turned around so it's more equitable. Thank you.
Thank you very much.
Mr. Chairman, Dwight Hanson on behalf of CDSA, we absolutely endorse and support everything that Greg DeDeer just said on behalf of the ARC, 100%. The one thing I would point out to you numerically here is a 1.25% cut is nearly $52 million. That's what's coming out of the hides of the providers, is $52 million. I understand the state is going to save $25 million in general fund, but don't be fooled. This is not a $25 million cut. It's a $52 million cut. And after $334 million and even more in the year before that, we simply cannot absorb that big a cut. We need to find another way to save those dollars and allow the providers to continue to move forward.
Okay, thank you very much.
Hi, I'm Mike Huckins. I'm the volunteer president of the California Respite Association, and I'm also a budget advisory work group member. I'm here tonight to talk about what happened last year a little bit, and then obviously about the additional rate reduction. So we've been polling the in-home respite agencies and one respite facility in the state related to the reduction in actual hours, and our figures actually are showing more significant loss than the estimate that the department has been providing, and we think it's partly due to the survey was geared mainly toward the early start impact to respite, and also to the respite cap or the respite standard impact, but it doesn't really include all the other types of things that have been happening, like family cost participation program, in-home support service conversion, and other things that are happening. So what we're telling you is that respite's been impacted more than anticipated, and so what we would like to request is an alternative, and it's been endorsed certainly by the other parties before me, and we're looking at something like whether it's hopefully something that's easy to implement across all families, or something like using authorized hours and just take a certain percentage off the top, so that we can at least spread the the burden over the number of families. And so we've also provided additional language in terms of exemption qualification, because we feel that communications related to the exemption process could have been better. There's also supposed to be a respite task force. We'd like to see that happen right away. We've had that request in for a couple weeks now, and we haven't had any follow-up yet related to that. We'd like to see it happen this legislative cycle. And then in terms of the 1.25 additional rate reduction, we believe that obviously the entire community of providers, regional center and service folks, have been more than impacted this go round, and so we really need to not have that happen, and especially to the services that have been majorly impacted. The information was provided at our meeting, but we're not in agreement. So I know maybe there was a feeling there was consensus, but I don't see that. Okay.
I don't believe that Ms. Delgadillo is claiming that. So.
Okay. Thank you.
Thank you. Yes, sir.
Hello, my name is Kevin Rath, and I am the Executive Director of Manos Home Care, which is a respite care vendor for the Regional Center of the East Bay. We've been providing respite care services since 1992, and I'd like to support everything that's been previously said. I'm a member of the California Respite Care Association, too, working close with Mike. So it really does affect people. It really does affect providers. We were just about to give a little bit of a raise to our workers when the 3% cut hit. And we didn't do that, but we didn't cut wages. And if this continues to happen, it's got to come somewhere. You can just keep hacking at agencies, taking 3% here, 1.25% there, and after a few years, you'll find that you've dismantled the collective expertise that was built up over decades. And I urge you to really consider that when you get proposals from DDS like, oh, it's going to be fair if we just hack away at the provider's costs little by little. So I hope that that's taken into consideration when you're trying to figure out how to resolve the deep budget crisis here. Thank you.
Thank you very much. Welcome.
Hi, Catherine Blakemore. Today I'm here on behalf of the State Council on Developmental Disabilities. I sit as a member of that group. Their staff person had to leave given the lateness of the hour, and I'm simply asked to express that the council is deeply concerned about the impact ongoing cuts will have on the developmental disability system. The community is fragile and frayed, and any additional cuts will simply exacerbate the concerns that are always going for that are continuing. Thank you.
Thank you very much.
Evelyn Abu Hassan on behalf of Disability Rights California. Given the interest of the lateness of the hour, I'm going to keep my comments very brief. I have given the sergeant some written testimony, which I'm sure he'll get to you. Just a few brief comments. I'm going to echo a lot of the comments that Ms. Blakemore just made. We are concerned about the fragility of the community system. And while the department has done a great job in terms of trying to bring down some additional funds, and that is to be commended, those concerns remain. We do also, and I've said this in other hearings as well, have concerns around the notice issues. I'm not going to go into a whole lot of detail here. We are pleased to see the trailer bill proposal that you all will hopefully be considering and approving. We know that folks are not being given notice of reductions to their services, and they're not being told about the exemptions that are available. So we are very pleased to see that. That's something that this committee is going to be considering shortly, hopefully. Thank you.
Thank you very much. Yes, ma'am.
Hello. My name is Teresa Brakefield. I work for Valley Mountain Regional Center in Stockton. We cover 5-county area. The only thing that I can say about the reductions is that our budget, our administration that takes care of our budget is extremely astute, and she has avoided any furlough days or anything for us as the employees there. But the impact of reducing the funding for services, which would be the DME, the housing, the reducing people's hours of providing services for the people who need them the most, that definitely impacted the consumers. And sometimes the consumers might not have seen it directly, but certainly the service coordinators have. And then we're in a place like, well, you know, how much should I tell them? They certainly have a right to know, but really, how much should I tell them? Because what's going to happen is they're going to I'm in their home, so they're going to turn around, and this is the person that they yell at because they don't see you, and they don't talk to you, because many of them can't leave their own home. But this is the person that they yell at. And so a lot of people were saying, well, you know, because Arnold was doing this and Arnold was doing that. Well, I don't care what Arnold's doing. This is the face that they're yelling at. And it's just not very, very good. Plus, you're putting a lot of people at risk. A lot of fragile health fragile people at risk when you start reducing funds, because I'm thinking, I'm hearing this all day today and all afternoon, and I'm thinking, when is it going to be too much? When is it, when we come up here and say, I've got 2 people that I cannot place, when is it, why does it have to get to that point? Because really, we don't want it to get to that point. And from all these cuts that I hear, that's where it's going. It's going to go, it's like you're testing, taking. When is it going to get to that point where we say, I don't care what you expect, it's not there because the funding is not there, period.
Okay. Well, thank you very much. I appreciate your testimony, and thanks for sticking it out to be there with us.
Marty Emoto, California Disability Community Action Network, family member, and at 749, still in opposition to these reductions. You didn't wear us down. You didn't wear us down. But I do want to say one thing. Appreciate, despite our differences with the department on this proposal and on some other proposals, appreciate the work of the department. I think the department has been really good in trying to minimize the reductions, even though we don't agree with the proposals. I don't doubt the sincerity of the staff in trying to do the right thing. And all we ask for is that the administration and the legislature look for other ways. No more cuts. Thank you.
Thank you very much.
Good evening, Mr. Chair and Mr. Emerson. My name is Simeon Gant, and representing Service Employees International Union. And yes, we are opposed to the $25 million reduction. Just yesterday, one of our members asked, if this continues, especially after we told them about the 1 1/4 additional cut, they asked, are the service providers going to go out of business? I didn't have an answer for them. We just don't know. They're already at the tipping point. They can't take any more cuts. I appreciate what Terry said about the relief for service providers, and maybe there's something else there that we can discuss, so I can at least tell our members that it's not over yet, but it's dangerously close, and we just want to make sure that this Lanterman Act no longer gets chipped away anymore. It's just at the point where the state will actually lose money, too close to litigation at this point. So we just hope that we understand where you're coming from, Mr. Chesbrough, and we appreciate your advocacy, and we just, again, oppose those cuts. Thank you.
Thank you very much for your comments. Appreciate you being here. Last but certainly not least.
You're always too kind. I think I'm delirious here. It's hard with term limits, as I've mentioned before, to keep track of where people are, and I'll always look at you, Senator Chesbrough, and now Senator-elect Emerson here in the Assembly, so I must be dreaming or something. So anyway, I'm Rick Rollins. I'm here in 2 capacities today. First, I just want to touch as representing ARCA, the Association of Regional Center Agencies, on your placeholder language for the notice of exceptions. We look forward to working with the staff and the other stakeholders in drafting language to meet the needs as outlined in this language. We, on policy concerns, we're in support of the policy that you're trying to get at, but we want to make sure that in the implementation for our staff at the regional centers that we're not adding additional costly burdens to the process. Secondly, as the budget budget advisory committee member representing the autism community, I'm here on behalf of the Alliance of California Autism Organizations, and just to share with you the concerns that the autism community has about the current reductions in services. We're concerned about all the reductions, but particularly the change in eligibility to Early Start has had a devastating impact on our community. The elimination of respite for Early Start clients and the respite reduction as well, generally speaking, and some of the social rec programs that are now no longer being funded are of a concern to the autism community. Thank you very much.
Thank you very much. That completes public testimony. I did have one question for Finance. Is there a possibility that the $25 million would be exceeded by the additional 1.25% reduction?
Hanoi Wang, Department of Finance. It's a little early to tell at this time, but our projection is still that we're shooting for the $25 million.
Okay. If there's no further questions or discussion, I think we'll call it a day. Thank you all very much.